Okay, here's a bit of a follow-up question for the same person we just asked before. What is the proper way to take clenbuterol, and is it actually contraband as well? Since we just talked about that, how many weeks out from a show would you start? And do you know of any other better fat burner or supplements such as ECA than Clen?
Clenbuterol is another one that is not available in the United States. Okay, it's really for beta agonist. It's for
Asthma, right?
asthma.
Right.
Yeah, and we use albuterol in this country.
Is it because it's too long? I read somewhere because it's too long acting. Is that the problem? That's why you don't.
You know, asking me to follow the logic or lack thereof for what's available and what's not.
Okay.
You know, there could be so many factors involved, not just political either.
Yeah.
It could be any number of reasons, because there's lots of drugs that are very useful for different conditions that maybe because of, again, maybe a political reason and tariffs, we don't have it. You know, it's made in Japan and we don't want, I'm not going to name names, but I can think of something just for GI upset that's available in a lot of other countries but not in the U.S. And it's so simple. But anyway, your question about clenbuterol, there's very little support actually in the literature, because I've looked it up before, for use of clenbuterol versus say albuterol, differentiating it somehow as an anabolic, which makes no sense. It's the receptors they're activating lead to catabolism, no matter how you slice it.
Really?
But you read what I found are just equivocal studies saying that somehow you get the best of both worlds. It's going to help you lose fat but still hold muscle.
Yeah.
I know guys use it when they're trying to dice up for a show, but I can't say that there's any literature, nor is there physiological logic behind using clenbuterol to hold muscle while losing fat. If anything, it might help you lose fat, but the legend that it's also got some anabolic activity is just that, as far as I can read in the literature. Now, I know guys use it all the time. And
would you say you could actually even lose muscle on it?
Sure.
Wow.
Sure.
Okay.
It's definitely considered, you know, part of a catabolic activity in the body.
Wow.
Well, but you know, a lot of things are. I mean, when you're going and doing your LSD on the long slow distance on the treadmill, that's catabolic. You're trying to get rid of tissue, fat tissue.
Yeah, but that's a big misconception about the Clen. I think most people, as you just mentioned,
that it's
said,
somehow muscle
you build
sparing,
muscle and you lose fat while you're on it.
And I think probably a lot, like with so many studies, a lot of it has to do with the level at which you're exercising, the dosage of the clenbuterol. So many factors are involved. You know, cortisol is also misunderstood. Bodybuilders want to stay away from cortisol because of the potential for muscle loss. It's considered catabolic, but also cortisol can burn fat too. So, I mean, if you ever see somebody with a cortisol excess, as a matter of fact, the skin on the extremities is usually paper thin everywhere but around the midsection, where they tend to collect adipose tissue. So there's just too many factors involved to say this does this or this does that. So you have to, you know, a lot of times you have to look at these studies and use a little bit more judgment and common sense, for whatever that's worth. But you know, guys have sworn by clenbuterol for a number of years, and I can see why. As long as you're stimulating muscle growth by working out and perhaps using something that's anabolic to counter the effects of clenbuterol, I can see how you can hold muscle and lose fat. The problem is, particularly with bodybuilders, that you're using so many different drugs.
You don't know what.
How do you know? Well, my favorite is thyroid, Cytomel, T3. Guys throw in Cytomel in their cycles to cut up all the time, and it makes no physiologic sense, because 25 mics of Cytomel is not going to do anything, and yet people swear by it because your body will simply say, you know what? If you're giving me, here's my set point. If you're giving me something, then I'll just rest. Okay, you put something on top of it and your body goes like this. And you're going to stay pretty much the same. With one caveat that if you give your body, twice the normal physiologic amount, then it can only drop so low, and you will be overdosing on thyroid, and then you could have an effect possibly to what you're looking for. But we've tested time and time again the use of thyroid in weight loss, and it doesn't work. And yet it's part of a bodybuilder's 16 things
arsenal.
They're using for getting ready for a show, and people will swear by it. But I challenge you in a nice way to show me how you can prove that it was a thyroid use that helped you get diced for that show, and not the other 15 things you were using.
Yeah, you wouldn't know unless you actually only did that. Yeah,
right. And so clenbuterol might be part of that. Now, I'm not saying it doesn't have value necessarily, but the claims made, in other words, hey, this stack of 16 things got the guy, along with everything else, to the title, the podium, okay?
Yeah.
But what I hear a lot in what I call the gym science is the physiologic mechanisms attached to it, which get crazy. It's like the lady, and it's hard to argue because the lady, Stephen Hawking's used the example of the lady that claims that the Earth is spinning on top of 6 giant tortoises. You ever heard that one? And I might be getting it wrong, but how do you even begin to counter those claims? Well, he's Mr. Universe, and he said that or Mr. Olympia, right? And he uses this in his stack, and it included clenbuterol. How can you argue with that? Well, it's easy, but where do I start?
Right.
It presupposes a lot of things.
Yeah. What's in the gym out there? I'm sure he wants to know. Part of the question he wants to know that is the way to use clenbuterol is always not every day, but on a 2 days on, 2 days off. So
well, the problem with clenbuterol is, like a lot of drugs, is you can accommodate. You can desensitize the receptors to it, and I think, and this is stretching my recollection quite a bit, but I want to say that roughly you can use it for about 6 weeks before it starts to desensitize, or you lose effectiveness.
Okay.
And one of the things
for 6 weeks.
Yeah.
Okay.
And of course, you'd always want to start at a lower dose,
right? With
the lowest effective dose, and then as you start to accommodate, maybe increase the dose to a certain point at which you stop. But there is a drug, I believe it starts with a K. Sorry, I'm not going to remember this off the top of my head, but it's like Benadryl. It's a foreign version of a Me Too drug like Benadryl. That somehow helps potentiate clenbuterol and keep it from losing its effectiveness. So conceivably you could use Benadryl in this country.
Wow.
To prevent that.
Working.
Yeah.
Wow.
Or keep it working longer.
That's pretty cool.
Yeah.
Okay. So even if you wanted to do the 2 days on, 2 days off, you could say pretty assertively that if you did it for 6 weeks every day, that would be working well without stopping.
Yeah. Now, if you use another catabolic drug that's not the same makeup, it's not working on beta receptors, but phentermine is a diet drug. Been around for a long time, at least since the 70s. The protocol, I think, from the American Bariatric Physicians Group is to go 3 weeks on, 1 week off.
I see.
So the same idea, you don't let your body get used to anything by going 3 weeks on, 1 week off. So that something like that, like you're saying, 1 day,
2 days on, 2 days off is what most people say.
Is probably going to effectuate the same thing.
Okay, gotcha. Thank you, Doc. Okay, Doc. Hi, I subscribed to your channel because of Ask the Doc series. Great series. They love you, man. Please ask the doc. I'm a 43-year-old male. My total test is 441 free test. 441 free test is 9.5. My E2 is 13.5. I don't know what that means. I have sleep apnea, which I am treating with a CPAP machine for 10 years now. My pressure is 6 cm, which is mild. I'm feeling all the symptoms of low normal test. Is there any reason why I should not go on to TRT because I have sleep apnea? What are his thoughts on blast and cruise protocol? Example, test cypionate 600 milligrams a week for 12 weeks, then cruise 150 to 200 milligrams a week for 16 weeks.
Okay, now we're in my bailiwick. Okay,
good.
Hormone replacement therapy, and I see people with breathing difficulties a lot. Okay, and the doctors will hesitate to prescribe testosterone replacement therapy to those with sleep apnea because it can leverage the effects of sleep apnea, and I'll come back to that. So first of all, with the below 450 nanograms per deciliter of total testosterone, by definition, well, you know, everyone's got an opinion. You go to 10 doctors, you get 10 different opinions. But for the most part, I think there's consensus in this country. Dr. Morgenthaler, the urologist associated with Harvard, will say fairly unequivocally that 450 or below is considered hypogonadal, a fancy way of saying you have low T. Okay, when you're just looking at total testosterone. And now there's more consensus to say, look, it's not just total, we have to look at free, because that's really where the rubber meets the pavement. You have total testosterone, but like I could have $1 million across the street in the bank, but if I can only pull out $25 a day, a lot of good that does me, right? So free testosterone is really what's more important. And of course, overlying all this is symptoms. Again, you treat people, you don't treat numbers. Is he complaining about low energy, low libido, low sense of well-being, all the things we've talked about, body composition changes that, you know, I'm working out twice as much and eating half as much and I can't lose the fat, that type of thing. We start there, and then you can confirm it with these numbers, and yeah, that's in the ballpark for sure for consideration of testosterone replacement therapy. The hesitancy, again, coming back to sleep apnea, is that with sleep apnea, if his CPAP machine isn't adjusted properly, meaning he's not getting sufficient air, effectively what he's doing is he's training his sleep, training cardiovascularly. He's going into oxygen debt. His oxygen saturation will drop. Who knows how low it'll drop. You and I can be sitting here talking, and I'll, even in my long-windedness, will stop and take a breath if my oxygen saturation gets down to, say, 95%. Catch up. When you're sleeping, however, you are, dead to the world. You're snoozing out, and I've seen it on sleep study reports where guys will drop into oxygen saturations of the high 60s, 68% before they will wake up or adjust the saturation by breathing again. Okay. Wow. So what happens when you're doing that is you're sending a signal to your body, hey, I need more oxygen. By some mechanism, activate that mechanism, hemoglobin is produced. Hemoglobin is the part of the red blood cell that carries oxygen. So your body is begging for more oxygen. Well, testosterone leverages the creation of those red blood cells and hemoglobin. That's why athletes that aren't necessarily bodybuilders, bicyclists, let's say, might use testosterone to further their ability to increase their VO2 max, to create more oxygen carrying capacity. So the fear with a lot of doctors is, oh, we're going to make your elevated hemoglobin hematocrit even worse by giving you testosterone. And it's a justified fear. If you don't correct the problem, which is not getting enough oxygen while you're sleeping, then yeah, you'll leverage that effect. So, I can see by someone's lab work, oftentimes I'll get a CBC and you see, oh wow, you're, we'll call it a weekend athlete, and yet your hemoglobin is 16.9. That's at the higher end of the range. I'll ask him, does your wife complain about your snoring at night? Oh yeah, how'd you know? Well, because you've got the blood of a really well conditioned athlete. Look, I in my practice deal with world champion boxers and bicyclists and guys that get paid to stay in really good cardiovascular shape. I don't normally see hemoglobin of, certainly not 17, in trained athletes. And yet here's a guy that's a weekend athlete coming in with a hemoglobin of 17. I got a pretty good idea that there's sleep apnea involved. So anyway, fix the problem. This gentleman here should have his respiratory therapist come out and make sure his CPAP machine is adjusted properly. And then he's not at increased risk just because he's using hormone replacement therapy. And yeah, he should look into it with his doctor, because based upon those numbers and assuming he has the symptoms, that yeah, he would definitely be a candidate for
So
therapy.
they're two separate issues.
And he'd feel better for it. Yeah.
Yeah. Gotcha.
Well, yeah, they're separate issues. Yeah,
Okay.
not everyone who starts hormone replacement therapy is going to get elevated hemoglobin and hematocrit. That's for sure.
Right.
It's got to be leveraged by something.